What is osteoporosis? Osteoporosis is a bone disease that occurs when the body loses too much bone, makes too little bone, or both. As a result, bones become weak and may break from a fall or in serious cases from sneezing or minor bumps. Osteoporosis means porous bone. Viewed under a microscope, healthy bone looks like a honeycomb. When osteoporosis occurs, the holes and spaces in the honeycomb are much larger than a healthy bone. Osteoporotic bones have lost density or mass and contain abnormal tissue structure. As bones become less dense, they weaken and are more likely to break. If you're 50 or older, have broken a bone, ask your doctor and healthcare provider about a bone density test.
Symptoms and signs. In early stages, there are no visible signs of osteoporosis. As osteoporosis develops, symptoms become more visible. Signs of osteoporosis include weakened bones, back pain, gradual reduction in height, poor posture, and easily occurring bone fractures. Causes. The likeliness of developing osteoporosis depends mainly on one's peak bone mass, typically achieved in their early 20s. Other factors include genetics, gender, race, diet, lifestyle, and age. Age is an important factor because of the reduced production of sex hormones as a person ages. This leads to a slower rate of bone mass production. Women are more likely to develop osteoporosis than men. People of Caucasian and Asian descent are more likely to be diagnosed with osteoporosis. Diet also plays a role. A diet with low protein and calcium intake can lead to osteoporosis. Lifestyle is also a factor. Those living a sedentary lifestyle are more at risk of developing osteoporosis.
Treatment types of osteoporosis include exercise, nutrition, and medication. Exercise increases bone formation through ossification and in severe cases slows down bone resorption. An increase in bone mass density is seen when adaptations to an overload stimulus occur similar to skeletal muscle. A greater increase is seen through weight-bearing exercises in which the body is supported by muscles and bones, as in running, stair climbing, and resistance training. And it usually takes 6 to 8 months of exercise training to detect measurable change in bone mass density. For nutrition, foods containing calcium and vitamin D help support bone formation and calcium absorption. Foods containing calcium include dark leafy greens, cheese, low-fat milk and yogurt, broccoli, and almonds. Those with vitamin D include fatty fish, as in tuna or salmon, cheese, egg yolks, and also milk and yogurt. Medications include anti-resorptive agents as in estrogen and anabolic agents as in the parathyroid hormones and teriparatide, which stimulate bone formation.
My life before osteoporosis was pretty normal. I was able to perform at a high level, similar to those of my teammates. But as I transitioned onto college soccer, I noticed the game was a lot difficult, and as a result, I ended up fracturing a rib during the competition. I did not know I had a fractured rib. Up until a few weeks of training, I noticed the sharp pains, and I was rushed to the hospital because of this. It came to a point where it was really hard for me to breathe, and that's when the doctor told me, or he had noticed that I had severe bone loss around my ribs, and he told me we had to do a bone density test. After that test, it showed that I had osteoporosis, which was not surprising to me. My mom had it, my grandmother had it as well, and unfortunately, about 2 years ago, I was currently diagnosed with osteoporosis. Hey guys, well, it's been a year now since I got diagnosed with osteoporosis, and yeah, I'll tell you this: my life has changed for the better. I never felt this good before. But yeah, I've been keeping up with 2 of my treatments that my doctor assigned me. One of them's being maintaining proper nutrition, and the other one is being involved in some sort of exercise, whether it's aerobic or resistance type exercise. I'll tell you this: at first, I felt a little clumsy at the gym. It's what I decided to do. My posture wasn't all there. I would fall quite often, too often to be exact. But within the 12-month span, I developed proper form. My posture had become a lot more stable. Walking up and down the stairs had become a lot easier for me. My nutrition has changed a lot as well. I been eating tons and tons of vegetables, fruits like crazy, and nothing fattening, just all stuff that's high in nutrients. But yeah, I'm excited to see what the next year has planned for me and how I develop within the next 12 months.